Today's research scholar is Lisa Werth, who's a Wright Research Scholar. And Lisa will be talking about promoting cervical cancer prevention among women in Panama City, Panama.
Can you hear me? Everybody can hear me okay? Thumbs up. Great. Thank you so much. I'm so excited to be with you all today, and I also would like to thank my donors, the Wright Foundation, for the incredible opportunity to pursue this research project. As you can imagine from this first slide, my project's going to be a little different, it's a little outside the box. This was an interdisciplinary international research project that I worked on, so I just want to share the incredible journey that I've had that's taken me across the country, across the continent in a lot of ways, and I hope you enjoy the ride. Let's try that one more time. Okay. Okay. So my project was focusing on cervical cancer. Why is cervical cancer important? Although over the past 70 or so years we've made enormous leaps and bounds at decreasing the incidence and mortality of cervical cancer with the Pap test, this is not a globally equally distributed technology. So it's the fourth most common female cancer with over 500,000 new cases every single year, almost 250,000 deaths, and almost 90% of these deaths occur in less developed regions of the world. Even within the United States, there's great disparities between different subpopulations. Latinas have much higher prevalence and mortality rates for cervical cancer. In cervical cancer, Latin America and the Caribbean, this type of cancer kills more women than any other type of cancer. So our journey is going to start here at my home, the School of Medicine at USC, specifically here at the Department of Preventive Medicine, which participates in a campaign known as the STMPO campaign. This is a collaborative effort between multiple schools at USC that is working towards improving cervical cancer screening and prevention, especially among Hispanic populations, starting with a goal here in Los Angeles, but the campaign has dreams of taking this nationally and even internationally. So, the next step in our journey is going to be all the way over here in Bethesda, Maryland to the NIH. My research mentor, Dr. Vasconti Garbonati, and her colleague, Dr. Murphy, applied for a special research grant a few years back, known as the NIH Director's Transformative Research Award Initiative. It was awarded funding. It was one of 4 projects in the past 40 years from behavioral sciences, and is basically seen as having the potential to transform the way we deliver health education, both here in America and abroad. And this grant basically focuses on storytelling, the power of narrative, as an incredibly insightful, impactful way to communicate health information in a way that's meaningful to patients and in a way that's going to promote behavioral change. So, this research has been underway here at the Keck School of Medicine at LA County for several years now. They developed a special narrative film called The Tamale Lesson, which is a short little 12-minute telenovela, sort of like a soap opera format, where it's a family talking about cervical cancer. Very funny, very engaging, and there's some promising results already that it's more effective than traditional, kind of more lecture-style teaching as far as promoting behavioral change in women. But as I mentioned, this campaign has always had dreams of taking this project internationally, which is where I come in. So now we're going to take a journey to Panama City, which is where I have been living and working since July of this year on this project. Cervical cancer is extremely important in Panama City. It's the second leading cause in terms of incidence and mortality among women. And Pap testing, which is basically the way we screen and detect cervical cancer at a stage at which it can be treated, coverage is quite low. Less than 1 in 5 women are regularly receiving this test. There's a lot of room for improvement here. Pap testing is also combined with other preventive efforts, the HPV vaccine specifically. And Panama is actually a world leader on this. Since 2008, Panama has been offering the HPV vaccine completely free of charge to all 10-year-old girls in the nation as part of their national vaccine program. They're the first country in Latin America and the second country in the world to do this, which is wonderful. But since this has started, there really hasn't been any research into public perceptions and knowledge about this. Do people know about it? Is it being utilized? Is the public accepting of the vaccine, or has this sort of been snuck under the radar onto the vaccine roster? Which brings us finally to my project. Sorry for the somewhat lengthy introduction, but it was not exactly a direct path. A little bit of a circuitous route to get here. So, our main goal of the project was to identify knowledge, attitudes, and beliefs of Panamanian women related to 3 subjects: cervical cancer, HPV, and HPV vaccine, to identify opportunities to improve current prevention efforts. Based on those results, we also wanted to create and disseminate a culturally appropriate educational intervention to improve these efforts. So, this is sort of an overview of the study design. This was community-based participatory public health research, field that I had no experience in before, but have got a lot of valuable lessons learned in the past year. We essentially used a mixed methods approach combining quantitative data that was collected from a survey and then qualitative data that was collected in a series of focus groups. To kind of zone in a little bit on each of the phases, our first phase, I had to do a community assessment, so I interviewed several key stakeholders in the community, and we also had to adapt and pre-test our survey instrument. So we used a survey that was developed here at USC for the main project in Los Angeles, but we had to translate it into Spanish and then make sure that all of the language was appropriate and understandable to Panamanian women. I had the wonderful opportunity to collaborate with another school here at USC. The USC MPH program goes down to Panama for 2 weeks every year. So I teamed up with a group of MPH students and they helped me pre-test the survey. And then here you can see me wearing a special vaccine backpack. They use this to bring vaccines to indigenous and rural areas in Panama. This was taken right after one of my community assessment interviews where I interviewed the director of the National Vaccine Program in Panama. So once we had our survey ready, we moved forward with data collection. I personally interviewed over 340 women in Spanish in 3 different health clinics in Panama City. We worked at 2 private organizations, ABLAFA, which is a Planned Parenthood International affiliate, and then UNSEC, which is this little crowd here, that's the National Cancer Society. We also worked in public clinics through MINSA, Panama's Ministry of Health, where I interviewed women as well. So we got all kinds of great information from this survey, but we still had a lot of unanswered research questions, and a lot of them were tougher to pin down with the survey. These were more emotionally charged subjects and subjects that required open-ended questions. So the next phase of our study, phase 3, was qualitative data collection, where we did a series of focus groups. Women were separated based on when they had their last pap test, and we talked about basically these issues and the emotions tied to them, their beliefs, myths that might be in the community. Part of this activity also included a viewing of the tamale lesson, which is the short video that was created here in Los Angeles, and we were hoping that this video might be able to be used in Panama, and I'm pleased to report that the women loved it. They laughed, they enjoyed it, they really, really connected with the film, so we're going to be incorporating that into our final educational intervention. We also incorporated brief educational workshops at the end. So this finally brings me up to where I am currently in my project. We've done all of the data collection. I'm currently working on the analysis, but we're also incorporating the analysis in with the production of our educational intervention. So we're hoping to create toolkits that are going to be distributed through promotoras, which are the health promoters in the community at the 3 different clinics that I worked at, and we're also going to be presenting it to the National Ministry of Health of Panama to see if they'll be interested in distributing it at a regional level to all of metropolitan Panama City. That toolkit is going to include USC's brainchild from the main project, which is the 12-minute educational film. And then we're also going to be supplementing it with some very basic low-level technology things to offer charlas, which are basically educational talks led by skilled health workers. Finally, the conclusion of my project will be the dissemination of these toolkits. We're going to be pre-testing the community and then distributing them to basically anyone who's interested in using them. We're also going to be presenting this data to the local and regional health authorities. I've already had several opportunities. I participated in 2 international conferences in Panama. I had to present in Spanish, which was an adventure. And then I was also invited back in February to speak at a World Cancer Day event through ABLAFA, which is a Planned Parenthood affiliate. So we're getting the word out, sharing the information with the local community stakeholders so that after I come back here and rejoin medical school, the work that we've done is able to be implemented and brought to the community. Just to give you a really quick snippet of the results, we interviewed 345 women, and basically they had heard about these things, they were familiar with HPV, but they had no idea that it caused cervical cancer. A lot of people hadn't heard of the HPV vaccine. Those who had weren't aware of where to get it or how many doses were necessary, so just huge, huge opportunities for health education. This is an example of one of the questions we asked, what causes cervical cancer, and you can see almost half of the women had absolutely no idea. Again, another thing we want to target for educational intervention. And for me, one of the most interesting parts about this project was the HPV vaccine and the attitudes of the women about it. As a lot of you probably know, this is somewhat of a controversial vaccine here. There's been a lot of buzz about it. A lot of people are concerned. Parents don't want their daughters vaccinated. And we found that this was an absolutely non-issue in Panama. Most of these women hadn't heard of it. When we told them what it was, they went, oh, great, I'm taking my daughter out. Where can I get my son vaccinated? Where can I get vaccinated? There's just this really powerful vaccine culture in Panama, which makes it that much more important for us to get the word out about this vaccine. It's great that it exists, but if people don't know that it's there and aren't going to the health center to get it, we aren't going to have the intended impact. We also looked at barriers in media habits, which will also inform our educational materials. Focus group data, we just wrapped these up a couple weeks ago, so we're still very early in the analysis, but to give you an idea of how emotionally charged these issues are, this was a quote from a woman who was talking about her personal experience with HPV and how traumatic it was for her. She was worried about having her uterus taken out and that she would cease to feel like a woman anymore. So you can see that there's a lot of stigma, shame, and fear attached to these topics. It's very taboo, but we found when we got the women together, they were actually very interested and excited to talk about it. We also found family as a motivating factor to get pap testing, which we'll be incorporating into our toolkits, and a lot of myths that we want to demystify for them, that HPV is the same as cancer or that cancer always causes death. So in conclusion, we found enormous gaps in knowledge and opportunities to improve the public awareness of both the HPV vaccine and screening with pap tests for cervical cancer. Future directions, I'm going to finish up data analysis, prepare the toolkits, and distribute them in the community. And we're also anticipating a cross-cultural comparison where we're going to compare the Panama data with the data that's been collected here at USC among Mexican-American women in Los Angeles. I'd like to again acknowledge the Wright Foundation and the Dean's Research Scholar Program. Thank you so much for this incredible opportunity. It's been such a journey. And I'd also like to acknowledge the Gorgas Memorial Institute, which was the Panamanian IRB that offered me guidance during the project, and the University of South Florida, which served as my liaison in Panama. Also, I'd like to acknowledge my mentors, many of them. I know Jean Richardson and Rosa Barahona, Dr. Nyquist, and several others are here today. Thank you all so much for supporting me in my journey, and I welcome any questions from you.
Do you have any questions for Lisa?
Great project. What were some of the major specific barriers that the women mentioned in like not getting vaccinated or not having their pap smears done?
You know, I talked to one woman who talked about autism with the vaccine, and it was kind of like, gosh, it's made it all the way down here, and this misinformation, how is this happening? But she was one out of 350 women that I talked to. There really were no other barriers to the vaccine other than the fact that if the girl's older than 10 or if it's a son, it's not free. And that cost is a huge barrier. So right now, only 10-year-old girls are able to get the vaccine in Panama. As far as cervical cancer screening, the barriers were a lot more, unfortunately, difficult for us to solve. There were a lot of fear of, well, what if it's positive, and well, if it's cancer, there's nothing I can do about it, so there's no point in me going in. So some of it is things that education will really help, but a lot of it is sort of just overwhelming emotions.
Great presentation, Lisa. Is there any data on the efficacy of the HPV vaccine with such low rates of pap smear, like specifically out of Panama?
Panama has been home to a lot of really interesting vaccine studies. It actually was one of, I think, 12 or 13 sites that got the original approval put through. As far as in different populations with pap coverage, I haven't seen any specific studies that look at that correlation. But it has been shown to prevent both oral and genital infections at very, very high rates. And right now, Panama's using the bivalent vaccine, which protects against 16 and 18, which cause over 70% of cervical cancers. So we can expect that there'll be an enormous impact in the next generation, but that's dependent on the current generation having good coverage of the vaccine, And I'd also like to see, in my final presentation, we're gonna try to nudge policymakers to see if they can maybe think about either a catch-up vaccination program or even expanding to boys. That could be a real pioneer in that field if we did that.
Thank you
so
very
much.
much.